It's a life-saving drug, but most of the city's first responders don't even have access to it. We're talking about Naloxone, a drug that can actually reverse the effects of an opioid overdose. Now, police say that over the weekend, there were 27 overdoses in the downtown core, 4 of them fatal. Currently, paramedics are the only first responders that have access to Naloxone, but that's about to change.
Once the proper medical directives are in place, once we have the proper training done for our staff, and we've acquired the drugs, Toronto Fire Service will have Naloxone on every frontline fire apparatus.
Toronto Fire is going to equip all 2,900 frontline staff with the life-saving drug. It's a cause firefighters have been behind for some time.
We're there to help people, so if this is something that's going to help, absolutely. You know, you take a look at some of the tragic lives that have been lost, some young individuals perhaps experimenting, and if there was something that we could do to help, of course.
According to the provincial coroner's office, there's been a 73% increase in overdose deaths in Toronto between 2004 and 2015. Rugnano says firefighters have been asking for the drug since then.
EMS service had all their basic paramedics by the end of December 2015 trained for it. That's when we first approached the city of Toronto, saying it would be a good idea for us to have the same drug and to have the same training.
But Toronto police, who respond to those very same overdose calls, have no plans to give officers those tools.
We looked for an entire year at every single occurrence that came through where there was a suspicion of opioid overdose, and in every single one of those cases, paramedics attended and offered trained expert medical assistance.
Lee Chapman carries a Naloxone kit with her at all times. She even saved a stranger's life with the drug last week when she saw him in distress on a downtown street. The registered nurse says minutes matter, and the first to respond should be ready.
People are getting trained in CPR. They need to be trained in Naloxone and be able to administer it. And certainly first responders need to have it and carry it and be able to administer it. Otherwise, in my view, they shouldn't be first responders.
Calls for overdoses or vital signs absent prompt responses from all 3 forces. But paramedics aren't always first on scene.
Moments matter here. So it's really nothing to put gloves on and just put this up somebody's nose and administer it, and it can make the difference between life and death.
Lee would know. Her brother died 2 years ago from an overdose. She said police had to wait 13 minutes for paramedics to arrive.
I'd hate to think that, that people are waiting unnecessarily. These are preventable deaths. They're entirely preventable.
The OPP announced it is outfitting its officers with the drug, as have police forces in Ottawa, Peterborough, and Barrie.
We believe that the solution for Toronto is to continue with what's been working.
Now, according to the Ontario Drug Policy Research Network, 2 Ontarians died every day of 2015 due to an opioid overdose, and those in the know fear that those numbers have likely climbed due to the recent prevalence and popularity of fentanyl.